If you have dizziness, what type of cardiology test would you get if you went to the cardiologist's office? And so basically, dizziness is not always related to your heart, but it could be related to different heart or vascular conditions. You can also be related to neurological conditions, which you would see the neurologist for, or some sort of inner ear type condition that you would see the ENT doctor for. And so, but if you had concerns, it could be related to your heart, then you would see a cardiologist and some of the tests you may get. So usually it would be normal either in your primary care doctor's office or the cardiologist's office for someone to check orthostatic vital signs. And so that means your blood pressure and heart rate would be checked when you're standing, sitting down, and lying down. And then usually you would also get an EKG at either your primary care or your cardiologist's office. And then other cardiology tests you might get include, a Holter or event monitor, which is like a patch ECG monitor that you wear 24 hours a day. It's water resistant, so you keep it on it all the time, and you could wear it anywhere from 48 hours to 4 weeks, depending on how often you're getting dizzy, because you want to have the dizziness while you're wearing the monitor. And that way, it can pick up on if you're having any abnormal heart rhythms while you're feeling the dizziness. That could be what's causing the dizziness. And then the other test a lot commonly people get is an echocardiogram, which is an ultrasound test of the heart. And it basically images the heart to see if there are any structural changes that could be causing your dizziness. And then you may also, if you have the risk factors for cholesterol blockages in the arteries, sometimes that can cause dizziness. People don't always get chest pain or shortness of breath when they get cholesterol blockages in the arteries of the heart. Sometimes they only feel dizziness. And so, if you have the risk factors or concerns for that, then you may get either a stress test. Sometimes people would get a cardiac CT or cardiac MRI if it's appropriate. And those are the main tests that people would get in relation to their heart if they did have dizziness. And then again, it may not, dizziness is one of those frustrating things where it's a lot of times hard to figure out what is actually causing the dizziness. And so you may have to see a few different doctors, a few different specialties before you actually figure out what is causing the dizziness.